But I just need you to understand everything that sugar is exposed to in your body unchecked, it damages, it causes inflammation, and it causes damages. So those sugars, the vessels, the same vessels that are going to your heart and to your kidney and to your liver are going to your hair follicle. And you can only imagine the attack that's going on that hair follicle, the inflammation at that hair follicle, the decreased blood flow at the hair follicle. What is going to grow? What is going to thrive? I believe conditions like diabetes, high blood pressure, obesity, high cholesterol, these are all conditions. Now, when I say diabetes, I mean type 2 diabetes. These are all conditions that we can take off the table.
And so one of the things that I appreciated about even our last conversation is that you believe that this all can be reversed, right?
Yes.
Through lifestyle, you believe that it can be reversed. So we're excited to welcome back Dr. Christine. And if you have diabetes, pre-diabetes, insulin resistance, if you know someone who has it, if you love someone who has it, this is the video you're going to want to watch, the entire video. So grab yourself something to drink, get a notepad, and definitely share this out. But you're going to want to watch this entire video as Dr. Christine talks to us and shares with us how we can reverse diabetes, pre-diabetes, and insulin resistance. Also, if the content is helpful, please like, subscribe, and share. Let's get started. Hi, everyone. Welcome back to my channel, Nourish Your Crown. And we are so incredibly grateful to welcome back Dr. Christine to the channel. Dr. Christine is a board-certified physician. She specializes, and actually I'm going to let her introduce herself. So I do want to say this. Number one, thank you, Dr. Christine, for coming back. In your other video, which we will link below, there were so many nuggets of truth and encouragement. And it was just such a blessing to hear how we can actually reverse some of these diseases. And that's what we're going to talk about today. We're going to talk about diabetes, pre-diabetes, insulin resistance, their connection to hair loss, and then what we can do to reverse. That's the most powerful piece, I think, about what our conversation is going to be about. And then for those who may not know you, again, could you give us a little bit of your background, but also, and I think this is what, for me, resonates, is that you have personal connections to these diseases and people who've experienced them and how you've worked with them. So can you tell us a little bit about your background, and then also some of your maybe personal connections, even with dealing with or supporting those with diabetes?
Yes, of course. So I'm Dr. Christina Nwoha. I'm an internal medicine physician and hospitalist. I work in the hospital. So I come into contact with a lot of diabetes, but a lot of diabetes on the tail end. So a lot of times when patients present to the hospital and they have a history of diabetes, well, if they're being hospitalized, that's because something's got out of control. I treat diabetic foot ulcers, ESRD, or like end-stage renal disease, patients that are on dialysis, patients who have had strokes. And a lot of times what a lot of my patients have in common is diabetes. So I treat a lot of diabetes. So even with that, I've had diabetes affect me personally, very closely, my family, very early in my medical career. I think a lot of the personal experiences I've had with some of these conditions have really led me to have a passion for optimizing and reversing these conditions because it's possible. I believe conditions like diabetes, high blood pressure, obesity, high cholesterol, these are all conditions. Now, when I say diabetes, I mean type 2 diabetes. These are all conditions that we can take off the table. We can take off as far as a burden, a healthcare burden, and really optimize our lives. And I feel like most physicians and the healthcare science community would agree with me. So none of the information that I'm going to go through is strange or taboo, or a lot of it is backed with science. So back to my personal experience, diabetes hit home with me with my father. And I'm a daddy's girl. I love my daddy. And I'd known that he'd had diabetes for a long time. In fact, when you talk about, a lot of times I'll ask my clients, what is your history with sickness and illness? And when were you first introduced to any type of sickness and illness? And for me, it was diabetes. I knew ever since I was a young girl that my father was struggling with issue with his sugars. I'd also seen him eating cinnamon rolls. I'd also seen him eating French fries and cookies and all kinds of stuff like that. He was a thin man, he's a handsome man, but he had diabetes. And I never really saw him trying to optimize his health. I saw him being compliant with medications, but still eating the foods that were putting him on those medications. And it wasn't until I was in medical school or even in residency when I got a phone call from my dad being in the hospital. Now, me standing in the hospital and getting a phone call from my dad in the hospital, and he was far away from me in a different city, I felt I felt hopeless. And I felt like, man, I let my dad down, because how can I be a doctor, medical doctor, and I can't help him? How can I be a medical doctor and my father is suffering like this? And I remember, of course, feeling the fear, all the imagery that you see in the hospital, all the outcomes that you know about, and it's running through your mind. I was so scared that when he eventually got out, I sat down with him and I said, Daddy, I don't want to lose you. His thought process at that time wasn't death. He was just like, okay, I'm better, I'm at home. But I was like, what are we going to do to make sure that this diabetes is gone? Like, how do we erase this?
Right.
And he thought I was crazy. You can't reverse diabetes. This is something I've had for a long time. What are you talking about? We walked back everything that he was doing. We walked back through his lifestyle. And to make a long story short, we reversed it. My dad was on insulin. He literally had to have a fridge in his room because he had to keep the insulin cold so that he wouldn't have to go all the way downstairs to get his insulin, his mealtime insulin, not on insulin. Not on insulin. Completely. It was to the point where he went to his physician, because he didn't believe me at first. And his family physician was his friend. They become friends over years. He'd been seeing the guy for over 20 years. And he asked him, my daughter wants to reverse my diabetes. She's a doctor too. Do you think this is possible? And he laughed and told him diabetes can't be reversed. The same doctor was peeling back and discontinuing his medications and sat him down and said, what are you guys doing?
Right.
So I think a lot of times it's not that the condition is not reversible, it's the lack of trust. And then sometimes the lack of will on the patient's side, because my father initially wasn't willing to do it. I think the only reason he agreed to do it is because I was so hard on him.
Right.
So when I saw the change that my father made, when I saw how free he is now, he doesn't have to carry around injectables. He doesn't have to measure his blood sugars at all times. He may not eat the same way. He may not move the same way, but he feels so much freer and he's more vibrant and he doesn't have that burden. I just want to share it with the world because it's possible.
Right. So number one, congratulations, because we need to hear those stories. But then also, let's go back a little bit for those of us who don't even know what diabetes is, or what is diabetes, what is insulin resistance and insulin sensitivity. There are a lot of, I think that the terms are becoming more familiar, but we don't always know what's happening in terms of the mechanisms behind them, which can help us understand. So can you talk to us a little bit? What is it? Because I remember growing up and she got the sugar, or the different terminology that we use in our families. But tell us about it.
Yeah, so let me break it down all the way to the core. And I'm going to speak in layman's terms so that everyone can understand it. I use a lot of kind of picture like words and references. But basically, when you talk about, we'll start with insulin resistance and what happens when you eat, just in general. So let's say, I have this bowl of nuts, okay? You eat your food. And when you eat your food, you need your food to be utilized. You need your food to be stored. You need to get that energy from your food, right? And your body has processes to make that happen. So when you eat, a hormone called insulin goes up in your body, and it signals different processes in your body to facilitate storing and utilizing that food that you've put.
Okay.
So one thing insulin does is it covers that blood sugar spike. It gets the sugars and the energy to where it needs to be. It starts storing fat. It's kind of like preparing for rainy days. We've got food. Let's start compartmentalizing it. Let's start putting it in places so we can store it for a rainy day. That's great.
Mm-hmm.
But what happens when you are triggering those processes too much, right? So I ate a cookie. My blood sugar spiked. Insulin goes up, starts facilitating that process. Cool.
Mm-hmm.
30 minutes later, I eat another cookie. The insulin, blood sugar spikes, insulin goes up, it starts facilitating those process. Okay. Then you eat a bowl of ice cream. The insulin, so now you've initiated a lot of these processes because your body's going to do what it has to do.
Right.
Over and over again for as many times it has to do it. Now, when we start having some what I would call deranged eating patterns, which are like abnormal eating patterns, or you're eating foods that are too high in sugar or imbalanced, your body is going to deal with that in the best way it can. But at a certain point, cells are going to start getting tired. Okay. And that's where you start talking about insulin resistance. So, for example, if you're having very high sugar spikes, and your body is having to release a lot of insulin to cover those sugar spikes, to cover what you've ingested, at a point, your body and your cells in your body get tired and numb from responding to that insulin. It's kind of like, let's say you have a sugar and the insulin is the key or the knock on the door on that cell to open up and let in that sugar. Mm-hmm. Well, imagine every minute, the cell is, and your cell is kind of tired. Like, okay, come on, we've had it. You're knocking every 5 minutes. You want something from us every 5 minutes. We're overwhelmed. We're just going to shut off. Some of us are just going to stop responding. But when you stop responding, that's when some of the disease processes. Anytime you let something go off the rails, off the hinges, that's when you start letting in disease processes. Now, when you think about it in that simple way, then you start to understand that reversal is by letting some of those processes get back to their natural state.
Right.
So I just want to say, so insulin resistance is when you're constantly, your cells are constantly flooded with insulin and they start putting up that defense that we don't want to respond anymore. And then you have different processes happening because of that. And then diabetes is when you have the insulin resistance. Type 2 diabetes is when you have the insulin resistance and you have other processes, other chronic processes, inflammation associated with that. Like, for example, you have the high blood sugars that lead to eye disease, heart disease, all of those implications, right? And then the type 2 diabetes can also start to shut down your pancreas because your pancreas is now tired of making that insulin because of always having that increased insulin from the insulin resistance. That makes sense. So it's almost like a linear process that started with, one could blame deranged eating practices.
Right.
Overwhelming the body.
Right. So, and that's a really helpful way. Just the way you describe it is like, I don't know, it reminds me of the concept around stewardship, right? And around like the idea of us being good stewards, right? Of the things of what we've been entrusted with. So what are some of the symptoms, particularly insulin resistance? Because I think I've read before, like you can have it for years and not know it, right? So are there symptoms or things that we need to be mindful of for, because we might go and get a normal blood test, which some of have, and I guess you could talk to us about A1C too, but maybe what are some of the symptoms?
Yeah, so some of the symptoms I would think about are sometimes chronic fatigue, right? Feeling tired after your meals. I would feel like those are some of the earliest symptoms.
Okay.
So that's telling you that your insulin is spiking up and down. So you're kind of getting a real-time feedback from your body of what's going on in your body. So if you're eating meals and all of a sudden you're feeling really tired, you're feeling really down, you're going through this like emotional roller coaster throughout your day, that could be a sign that your insulin level is spiking up and down, and you may be dealing with a little bit of resistance.
Okay.
Also, you can also have some physical signs, like I like to say around the neck, okay, behind the neck, you might have this velvety, thick, dark change, or in the armpits. Now, with darker skinned individuals, you have to be careful because some of us may have darker skin already, but you'll notice it's like a darker skin. We'll call that acanthosis nigricans. And they can also have like skin tags in the neck, right? So a lot of times I can be standing at the grocery store and point out patients who are having some kind of insulin resistance, right? Other signs could be that you're having difficulty losing weight. You're starting to put on weight, and it may not be all over. It may be just in the stomach area.
Right. Okay. Okay.
So those are a few things that you could think about, mainly your mood, some skin changes, or even greater propensity for infections. You know, you're getting a common cold a little bit more. Those are signs that you're having maybe some chronic inflammation.
Okay. And then when we think about the actual testing, and I do at some point want to talk about the connection between, and maybe we should do that now. What might the connection be between diabetes, insulin resistance, and hair loss?
Okay. So a lot of times I like to explain to my patients, sugar in the body is a toxin. Anytime you have any more sugar in the body that is exposed to any organ, any cell in the body, it is a toxin and it does damage. I like to explain it like those pinball games, you know, those pinball games where they have the little silver ball and you flick it and it just goes ding, 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 and it hits different things. You get points. That little silver ball is like sugar. And each thing it hits is like an organ. It could be your eyes, it could be your heart, your kidneys, your liver, your hair follicles. But I just need you to understand, everything that sugar is exposed to in your body unchecked, it damages, it causes inflammation, and it causes damages. Now, a lot of times when we are thinking about uncontrolled blood sugars and the damage it does to the body with diabetes, we think about the heart. We think about your risk for heart disease. We think about your vessels. Sugar in the vessels, you know, attacking those vessels, it causes damage and the vessels get narrower. Then you get decreased blood flow to different organs. We think about the kidneys and end-stage renal failure, kidney failure. We think about the eyes and glaucoma and how the sugars in the lens of the eye brings in water and damage. But a lot of times people don't talk about the hair follicle. So those sugars, the vessels, the same vessels that are going to your heart and to your kidney and to your liver are going to your hair follicle. And you can only imagine the attack that's going on that hair follicle, the inflammation at that hair follicle, the decreased blood flow at the hair follicle. What is going to grow? What is going to thrive? You want your hair follicle in fertile ground.
Right.
So when it's constantly with vessels that are plugged up like this and inflammation surrounding it, it's kind of like having a plant that's in dry, acrid ground. It's not going to thrive.
And I think, and I'm in a couple of forums, and one of the things that almost consistently women who are dealing with hair loss say, whenever they increase sugars, they can immediately tell that the impact on their hair or their scalp. How do we mitigate that, right? And so is it complete elimination of any type of sugar? Is it, because there's people say you should not have refined sugars. Is maple syrup or honey, or, you know, what are your thoughts around how do we, which is I guess what we're talking about, how do we manage this unchecked toxin in our body? Maybe that's, I don't know if that's I don't know. I might have to clean that question up, but maybe you understand what I'm saying.
I understand exactly what you're saying. So I wish I had my diagram, because I like to use this diagram where I talk about how the sugars spike in your body. And when you think about that sugar spike, you can also use an insulin spike to cover that sugar, right?
Mhm.
And the issue is how high that spike is, meaning
Mhm.
how much blood sugar is in your bloodstream at any given time. And what you want to do is decrease that spike.
Right.
You want to have more of a flat line. Like if I wish I could draw it out, but if you had like a diagram like this, you would want your
Mhm.
sugars to kind of be, you know, ebbing around the same. If up
Mhm.
here was red, you don't want that up and down spike. And what
Right.
causes
Right.
that up and down spike is, you know, I had a bowl of rice.
Mhm.
Boom. You
Mhm.
know, I had a bowl of ice cream and cookies. Boom. You know,
Mhm.
and a lot of times it's not so much about rice is bad, cookies are bad. It's how can I mitigate that spike,
Mhm.
right? How can I outsmart my body, outsmart my hormones, and not give them that spike? How do I not make it so that so much blood sugar enters my bloodstream at any given time? And there are hacks
Mhm.
for that. One
Mhm.
hack
Mhm.
I really love is the meal sequencing,
Okay.
right? Because we know that carbs itself are not bad, but when you eat carbs alone, like if I just ate a bowl of rice, I'm
Right.
going to get that spike. But if I can, in a way, eat my meals so that that carb hits my stomach last,
Mhm.
then that spike is blunted. So
Okay.
now eating the same meal, but you've tweaked it a little bit. So what we like to do with meal sequencing is I suggest that you have a vegetable, a protein or a fat, and a carb, and that
Mhm.
carb needs to be eaten last. So let's
Okay.
say you have a meal where you want to eat rice. Well, you'll have broccoli on your plate. Then you'll have your protein, which may be fish or beans.
Mhm.
And that beans may be cooked with a little bit of butter, olive oil, or something like that, a little bit of butter. And then
Mhm.
you have your rice. And once you start with that vegetable and that protein, when you're eating, your stomach is already releasing hormones like GLP-1,
Mm. Which
which
is
we talk about with semaglutide and all of that stuff that they're trying to increase, right? Your
right.
body
Right.
naturally starts to release some of those hormones that are already working to blunt that spike. So, yeah.
So okay. So you saw my my brain is going. So and I've so well maybe let's take a quick detour to
Mhm.
the GLP ones. So you're saying that, and I think I may have read this somewhere. Like our body has naturally occurring GLP ones,
Mhm.
and so there are ways that we can um, support the production of GLP ones in our bodies, even outside of using a medication, and that's with our food.
Yeah. So let me tell you, a lot of the treatments that we have for diabetes and for weight loss are surrounding hormones that your body's already making.
Mhm. Mhm.
There
Mhm.
is literally based on your body's already physiologic uh, system that's in place. So
Mhm.
when you talk about semaglutide and some of these other dulaglutide, Trulicity, um, they are GLP-1 agonists, and that they're helping to keep the GLP-1 along longer so that you can get
Mhm.
the benefits from them. But your body makes those hormones, those
Mhm. Mhm.
enzymes. Excuse me.
Yeah. Mhm.
So what they're doing is they're keeping your GLP-1 there long enough so that you can get more effects from it.
Right.
But
Right.
there are some things that you can do at home to increase that GLP-1 yourself as well.
Well,
And
let's
you'll
talk
see
about it.
one of them.
Let's talk about it. Let's talk about it. Let's go through those. Let's go through those things.
Yeah. So meal sequencing is a great one. You know, once you start eating those proteins and those fats, your body starts creating that GLP-1 and your body can utilize that, right?
Mhm.
Another good thing that can help with GLP-1 is, you know, staying hydrated, staying
Mm.
active,
Mhm.
you know, walking after those meals, you know, reducing the inflammation, probiotics, creating a good environment for your stomach. So your stomach isn't um, all tore up. You want to keep you want to keep that stomach lining
Right.
healthy.
Right. 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 Right.
So you know, you don't want to be eating and drinking foods that are caustic or that can be destroying that stomach lining. You want to eat, you just basically want to live in a healthy way, a healthy lifestyle, and prioritize drinking water, keeping your system flushed, eating things in a right meal order. Another thing that can help GLP-1s are certain foods, right? Like kiwi, avocado, prebiotics, berries, strawberries. And if you eat some of these foods first in your meal, you get that better effect. So it's almost like you're going to have to re-engineer and reverse how we've been taught to eat. Because a lot of times what you'll see people do is, I'll eat my strawberries and everything last after my meal because that's sweet. Or I'm gonna eat my rice first and then I'll eat my vegetables. Even though some of our parents and the old folks told us you got to eat your vegetables first.
Right.
It's getting back to that mentality for the better. And you may even find that by the time you make it to that carb, you don't even really want it.
Right. Okay. That's helpful. Now let's go back to diabetes. We took a little detour, but let's go back to the diabetes and insulin resistance. What are the tests that we should be asking for when it comes to understanding or where we are in terms of diabetes or even possible insulin resistance or even pre-diabetes? Like where should we be asking for?
Yeah. So there are different ways. So of course, when insulin resistance and diabetes, you start crossing the line of different symptoms. Now, when you start having, frequent urination, you're thirsty all the time, your mouth is dry, you're just really foggy, you're getting frequent infections, yeast infections, bacterial infections. These are all signs that, okay, we need to get to a doctor. We need to get some lab work done to investigate. Now, there are two ways your doctor can do it or can spot diabetes. And this is a lot of times your doctor will ask for a fasting labs. So they'll tell you to fast after midnight so they can see what your labs are. One of the labs they're looking at now, they're probably looking at your cholesterol profile, but one of the labs they're probably looking at are your blood sugars. So they're going to look at the blood sugar on that panel and they're going to see what it is. Now, if it's greater than 126, on that one occasion, that's cluing them in that there might be some diabetes. I think a lot of times they want 126 on two different occasions to seal the deal. But I mean, if you get 200, I think that pretty much tells us what we need to know. Right. Now, the other gold standard test, and I'm going to tell you why I didn't hit this one first, but the gold standard test is called the hemoglobin A1C. And that is a test that gives a number that estimates what your blood sugars have been for the last 3 months. So depending on, and that is usually a 1-digit number or a 1 digit and a decimal point, but it can range from generally 4 to about 15. If you're at 5.6, 5.7 or above, you pretty much have sealed that diagnosis for having diabetes. Or pre-diabetes, and I believe diabetes is 6.2. But anyways, if you're at 5.7, it's time to put on, it's time to buckle down, okay? Your blood sugars are running too high, and this is something that needs to be got under control. Now, here's the thing. I have seen people who go and get that hemoglobin A1C, and then they say, well, it was fine. My hemoglobin A1C was only 5. But I have all these symptoms, but I don't have diabetes. One way in which that hemoglobin A1C could be incorrect is with anemia, like low blood levels. So let's say you have someone that struggles with, heavy menstruation, or they're iron deficient for whatever reason, their blood levels are low. That hemoglobin A1C may miss diabetes or underestimate how bad your diabetes is, because it's a test that depends on the number is based on the assumption that your blood levels are normal. It's important to always balance that out with your actual blood sugars so the diagnosis is not missed. Another thing that we're seeing a lot of are these CGMs, which they're like the little devices that you put on the back of your arm, and it could give you a real-time measurement of your blood sugars. And what I love about that is that, and sometimes you can ask your doctor if you are having high blood sugar, or if there's a question as to what's going on, if you're at the borderline, you can ask them to write you a Freestyle Libre or a Dexcom or one of those devices so that you can see what your blood sugars are doing throughout the day.
Mm-hmm.
If
Mm-hmm.
you are sure that you are fasting and you are eating right and you don't know why your blood sugars are a little elevated, or you're having symptoms and they're not picking it up, maybe you are anemic, that can help you get some insight as to how high your sugars are spiking during the day. And
Mm-hmm.
what I love about that CGM is, a lot of times, even though it's good to know how to check your blood sugars with a meter and be able to prick yourself and get that number, it takes a thought process to complete the action, right? You
Right,
have
right.
to eat and then take it and know that you took it after you ate or before you ate or when you were fasting or when you had the, but the CGM is constantly monitoring. So you can see times where you spike up to maybe 400, and on the flip side, you would have never thought to check your blood sugar at that time. You know what I
Right,
mean?
right,
So it
right,
gives
right,
you a
right.
more comprehensive view of what your sugars are doing throughout the day. But there are so many modalities to use to nail down this diagnosis and to see what your sugars are actually doing real time.
Mm-hmm, mm-hmm. So with the A1C, you said 5.6 or 5.7 is pre-diabetes or
Yeah, so
diabetes?
I believe 5.7. Let me look at the guidelines because I'm not, let me let me be 100% sure.
Okay, because then my next question is then what is the target range for sort of healthy?
So 5.7
Mhm.
to about 6.2 is pre-diabetes.
Okay,
6.2 and up is what we would consider diabetes.
okay,
The target should be, I would say, around 5.
okay. That number is so like the the tenth of a point is like so small, like to
It
go
is,
from.
it's wild. And I'll tell you, so here's the thing. I know it seems like a decimal point or a number could vary so much, but that A1C, each point, even a fraction of a point, can tell you the corresponding blood sugar. Like, for example, if you have an A1C of 4, that
Mhm.
means your average blood sugar is 72.
Wow.
If
Okay.
you have an A1C of 7.1, that means your average blood sugar is 128. Now, remember I said a
Mm,
number of 126 or higher pretty much seals the deal. Now, if your average blood sugar is 128, that means there are some numbers that are far higher than that. That
right.
means if you
Right.
have like a baseline, it's going right about here. That it's elevated, right?
Mhm. Mhm.
Now, let's say a patient comes in and their A1C is 10.1. That means their average blood sugar is 182.
I,
So let's look at the actual cutoff. So 5.5, if your A1C is 5.5, your average blood sugar is 100. Now we
mm,
talk about pre-diabetes as far as blood sugars being from 104 to 125. So that tells
okay.
me everything I pretty much want to know. So if you
Mhm.
come in and your A1C is 5.6, I know that on average your blood sugars are running in pre-diabetes levels. And then so we
That
talk about what optimal should be. And if you were at 5.0, your blood sugars on average would be 90, meaning they're not really spiking above 100 even when you eat.
okay. So
You're not
that
getting those. Yeah.
that is really helpful. I was always curious how the numbers corresponded to the blood sugar corresponded to the A1C. So that was really insightful. So thanks for
Yeah,
sharing that.
I'll have patients that will come in and they'll have a hemoglobin A1C of 13. And then I'll ask them, what kind of foods are you eating? What are your blood sugars running? And they'll say, oh, well, they're running at about, when I check them, 120. And I said, no, because it, there's a disconnect because you're
Right.
on average at 246. So
Oh,
you're getting 300s and 400s
yeah,
somewhere.
yeah, yeah.
So we either need to figure out where those are occurring and measure our blood sugars more, because you might have someone that may measure it once a day when they wake up in the morning and they're not checking it after, a large tortilla or something. And they don't
Mhm.
know that that tortilla is spiking them up to 400. So
Mhm.
that
Mhm.
A1C gives us a lot of insight if it's when it's
Mhm.
accurate.
Right. And so what the one of the things that I appreciated about even our last conversation is that you believe that this all can be reversed. right?
Yes.
Through lifestyle, you believe that it can be reversed. So can we talk a little bit more? Let's talk about maybe some of the healing foods and teas and
Yes. Yes.
supplements that we can tap into that can support the reversal process.
Hmm. Hmm. Yeah. So for diabetes, I really think one should really focus in on the diet. I feel like that's where it's all at. I mean,
Mhm,
that's where it all started, right? I mean, blood sugars, insulin, all of that is uh, based in on what we're consuming and how our body's trying to regulate all of that. So we have to go back to the base of the problem and solve that.
mhm,
So one thing I always try to consider is if insulin resistance is caused by our bodies being overwhelmed by this insulin response, maybe we need to let our bodies rest off of this insulin
mhm,
response, which may require some fasting.
mhm,
And that was one thing that worked for my dad a lot. Um, Not eating mindlessly, not eating, sometimes we're like, okay, I'm just going to have a cookie. You're eating a cookie not because you're hungry, you're eating a cookie because you're eating a cookie.
right,
But
right.
that is still creating that insulin response and exposing your body to sugar. If you can fast and give your body a break from some of these processes that are already being run down, already your
Mhm,
body is signaling an alarm that we are tired, we are resistant, we need a
mhm,
break, then maybe your body can start to um wake up and feel safe
mhm,
and
mhm,
respond to some of the insulin.
mhm,
So intermittent fasting is good. Fasting between your meals is good. That's a great start. You don't have
mhm.
to uh, jump into a 3 days, 72-hour water fast. You can just start with, I'm just going to eat 3 square meals.
Right, right.
I'm going to eat my breakfast, I'm going to eat my lunch, and I'm going to eat my dinner. And after
Mhm.
dinner, I'm going to sleep. Or not directly after dinner, but I'm going to sleep and I'm
Right,
not going to do
right,
anything to my breakfast.
right, right.
And in between those times, I'm having quiet. Because think about it. You woke up, you ate breakfast. Okay. Then you ate a cookie. Then you ate a snack. Then you ate lunch.
Right.
Uh, let's do you woke up, you ate breakfast. And you give your body some time to come down to
Yeah,
baseline.
yeah.
And then you eat lunch.
Right, right,
Come down to baseline. Like at that baseline, that's when other things gotta happen.
right, 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 right,
There
right,
is a
right.
complete, we talk about fast versus feast.
Mhm,
And during the feast, there are processes that are happening, but there are also processes that need to happen during the fast, during the
right,
off period that we're not
right,
giving our
right.
body time to do. So it's like that that fast period is needed by the body, believe it or not.
Mhm,
So that's
mhm,
one thing you can do. Two, looking at the type of carbs that you eat. Some of the carbs, because they're so refined, because they're so processed, they just hit your body like whoo, like they just go in and they have no choice but to spike that sugar. So
right, right.
sometimes it's like I tell my clients and my patients, just examine that meal. If you're gonna eat breakfast and it's just this biscuit, that's just this white flour, know how that's going to trigger your body as opposed to eating like steel cut oats,
Mhm,
or
mhm,
eating a cup of yogurt in the morning. So making those swaps with your foods can have an impact on your sugar as well and take you from having that quick spike from a biscuit or a, quick spike from, eating, I can't even, I'm trying like a bowl of cereal, right?
mhm, mhm,
To having like a smooth from having some
mhm,
yogurt and
mhm,
some fruit,
mhm,
a smooth from having like some steel cut oats and some non-dairy
mhm,
milk.
mhm, mhm.
So those kind of swaps help as well. Um, there are certain things that you can even drink that can help your blood sugars. One of those things I'm drinking them right now, and that's green tea. So you can
That,
swap out
yeah.
coffee for green tea. Green tea has catechins in it that are great for adjusting and helping balance out your blood sugars,
Mhm,
right?
mhm.
What are some great supplements that I love to recommend? Chromium. Chromium, they have linked chromium deficiency
Mm-hmm.
to insulin resistance. So a lot of patients, they start chromium 100 milligrams
Mm-hmm.
and they'll notice a drop in their blood sugars. I had a client that wanted to try out chromium and she had to stop it because her blood sugars were dropping too low.
Oh, wow.
Okay, maybe we gotta we gotta
Mm-hmm.
stop the chromium because it was interesting. She was actually wearing a CGM
Mm-hmm.
and she was getting woken up at night because her blood sugars were dropping so low.
Oh, wow.
And we had to reach out to her PCP and adjust her medications. And she literally within like a couple of weeks had to come off of all. It was like a roller coaster. But
Wow.
some patients who are deficient in chromium will have insulin resistance. So that's one.
Mm-hmm.
Vitamin D.
Mm.
Vitamin D,
It's
y'all. Vitamin D. Like in this day and age, we can't just be out here um, chilling with a vitamin D deficiency.
right, right.
They have linked vitamin D deficiency to type 2 diabetes, worse
Mm.
outcomes, so I think there are even some schools and organizations of thought that you may not even need to get that level. Some people are so likely to be vitamin D deficient that it does you better to just get a good replacement and take that and
Or
reverse that deficiency than
mm-hmm.
if you're sitting around waiting to get a lab to confirm a deficiency.
Mm-hmm.
I've seen patients with numbers as low as 8. If you know that you're not out in the sun and you have a job where a lot of times we're behind a UV protected window during these hours, we're not
Mm-hmm.
getting that exposure, go ahead and replace.
Mm-hmm. Mm-hmm.
Especially if you're of darker skin tone, because that is a natural sunscreen.
Mm-hmm.
So a lot of times, believe it or not, we need a little bit more sun to get the same vitamin D that somebody else may get.
Right,
So
right,
vitamin D is something that you should definitely replace. I'm
right.
a vitamin D stan. I think
Yeah.
that's the best thing you can do for yourself is getting that level optimized, like up 40,
Yeah.
40,
Yeah.
you
Yeah.
know, if you can get it up there. And it can help with so many things like
Mm-hmm.
not only
Mm-hmm.
diabetes, high blood pressure, depression. How many people are feeling foggy and depressed on account of vitamin D? It's,
Right,
it's,
right,
it's so treatable.
right, right.
Another supplement that I like for diabetes is berberine.
I was going to ask
Um,
about that.
yeah, berberine. It kind of works like metformin, and they've done some trials where they go head to head. A lot of these supplements, they have done trials where they go head to head. Now, of course, there's a lot of money and research that goes into these pharmaceuticals, but berberine is a good one as well. My father has used berberine. I've had several clients use berberine with great success. The only thing that I say about berberine is strong. Um, so it's not something that I would recommend using like long term, for the rest of your life.
Mhm.
I'm going to take berberine for the rest of my life. We
Okay.
definitely want to use it like in short spurts, 3 to 6 months, 6 months, cycle off. And of
Mhm.
course, with these supplements, they're supplements. So that's why I went into like fasting and how to eat your meals, meal sequencing first, because these are the things that are going to stick
Mhm.
and these supplements are going to boost you. And
Mhm.
it's
Mhm.
it should be that, you've made changes so that you can come off of the supplements and you can just return to the supplements if you need them as needed.
Mhm. Mhm. Let's talk a little bit about some of the lifestyle changes, or not changes, but the lifestyle practices around sleep, around movement and exercise, around prayer. How might those help the reversal process?
Yes, yes. One thing I used to tell my father, and I tell my clients all the time still, is your muscles, when they need sugar, they need sugar. Okay. And they're going to take it out of your bloodstream. They're going to soak it all up. Now, the problem a lot of times is when we are inundating ourselves and we're eating these high sugar meals and we don't utilize any of it.
Mhm.
You know, the best thing you can do for your blood sugars is get those muscles moving,
Mhm.
get those muscles sucking up that sugar because they'll do it. They'll pick up that sugar. And I used to tell my dad, I was like, if you got out and walked after every meal.
Mm-hmm.
You'll even see some people say that I don't like to move around too much or get too active because my blood sugars will drop. And I'm like, see, you're onto something. You're onto something
Right.
because
that's,
you
that's the
know, if you
point.
know, right, that's the point. I want you to hold that thought because if you know that you eat and you take your insulin, and if you get too active, it might affect your blood sugars. Let's nail down on that. Let's make that a part of it. And I've had clients ask me, well, how much should I walk? And if you're diabetic, if anybody in general, if you can walk after every meal,
Mm-hmm.
like you would be utilizing your sugars. You will be kind of gearing those muscle cells to help you help yourself and
Mm-hmm.
utilize
Mm-hmm.
some of those sugars. And if you can't even walk, what I'll say is do some air squats. Like let's say you work in a job where you can't get outside. Not everybody has the ability to get outside. So you finish your meal at your desk and just stand up next to your desk and do 20 squats or
Mm-hmm.
20 arm swings, 20, whatever, and just kind of get those muscles moving because that's what you ate for. You ate to give your body that energy. So you can institute some movement throughout your day, institute some resistance training. They have shown that resistance training decreases your risk, lowers your blood sugars, lowers your hemoglobin A1C, reduces your
Mm-hmm.
insulin resistance. So, movement proven. If
Mm-hmm.
you are struggling with insulin resistance and diabetes and you are not moving, you're leaving it on the table. You're leaving
Mm-hmm.
your opportunity for reversal on the table. It doesn't have to be going to the gym and doing something fantastic. It could be just as much as I'm going to walk in place. I'm going to walk circles around my room. I had an aunt that would go out to the backyard and she was one that we got her hemoglobin A1C from 13
Wow.
to 6.
Mm.
And she would walk up and down the stairs 10 times. And she would go outside and walk in circles around the backyard. And she would get her vitamin D because she was like, she
Mm-hmm.
wants to get that vitamin D at that hour. She would go in at 11 a.m. and she'd be walking circles. And those are the kind of things that you're not even creating a environment for insulin
Mm-hmm.
resistance to thrive, right?
Mm-hmm. Mm-hmm. Mm-hmm.
Um, Sleep is important because a lot of hormones go on with sleep. And we could talk about cortisol. We can talk about some of these other hormones, but I want to talk about some of the hunger hormones at this time,
Okay.
right?
Okay.
So you have what you call ghrelin, and that's like your hunger hormone is going to make you eat. Then you have leptin, which is your satiated hormone, right?
Mm-hmm.
Now, have
Mm-hmm.
you ever wondered why? Sometimes you can see some people who are not, they're not people who want to eat that much. They're not very hungry people, okay?
Right.
One person on one end might be voracious, have a voracious appetite, got to eat, 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 eat. And then somebody else is like, I mean, I don't,
Right.
I mean, you could eat. I'm not that hungry.
Right. Right. Right.
But they have done science where they've measured hormones in certain people and found that certain people have more of one kind of hormone than the other. And some people
Mm-hmm.
who have one type of hormone tend to be more overweight. And that has nothing to do with even any decision you made. It was the hormonal biology that you had that predisposed you to the decisions you were going to make. I had
Mm-hmm.
more ghrelin flowing through my system. I can't fight that. It's going to be really hard to fight when your brain is telling you constantly that you need a burger, as opposed to your brain telling you that you can relax, you're not hungry.
Right.
So
Right.
when you have a poor night's sleep, you're going to have more ghrelin. When you pull an all-nighter, and you can test it on yourself,
Mm-hmm.
have a bad night where you're sick, or maybe not sick, but you have things to do, you're up partying, you're up with friends, you were up, that next day, you're going to want the fattiest, most dense meal. That's going to be the day that you're walking through the grocery store and you see those bag of chips and your brain is telling you it's okay.
Right.
You need this.
Right.
And how
Right.
do you tell your brain that you don't? Your brain told you you need this. You need this to survive right now. And so you're eating. Now, combat that. Now, let me give you a meal plan now. Let me give you my book and give you options to eat.
Mm-hmm.
You're
Mm-hmm.
combating poor sleep and increased ghrelin.
Right. Right.
You're not giving yourself a fair shake, you
Mm.
know? So having a good, proper sleep, 8 hours of sleep, rested sleep, could give you the ability to have better blood sugars because you're now in the right frame of mind to where you don't have all that noise, all that food noise that's distracting you. It's not an uphill battle for you. And even addressing certain conditions, like if you have sleep apnea and you're having heavy snoring at night and you need a CPAP. I have patients who need to be wearing a CPAP machine. It's tough. Maybe try being compliant with the CPAP and then you get better sleep so that you're not in that uphill battle.
Right.
You know,
right.
The worst part about it, I would say, and it can be really hard because when it comes to insulin resistance and weight loss and all of that, there are so many factors that are fighting against you.
Yeah.
I think a lot of times we don't give our patients enough credit because a lot of things are out of their control. Insulin is a hormone that will make you gain weight.
Mm-hmm.
If you look at the things that insulin does in your body, one of them is stops fat breakdown, promotes fat gain, it's promoting storage of fat.
Mm-hmm.
Imagine someone who's been diagnosed with diabetes, and I tell some of my patients this: expect to gain weight because you're injecting yourself with something that is meant to make you gain weight. So it can feel like an uphill battle. You're taking a hormone that's making you fatter, and you're trying to lose that fat.
Right.
And now you're battling with your weight. Now you're battling with sleep. Now, not only are you dealing with insulin, you're dealing with ghrelin, and you're dealing with cortisol, which is also making you gain weight around the middle. It can feel impossible. But you just have to keep at it. Know that you can peel the onion little at a time, and it's possible. And once you break through, you do the little things that you can do, and you break through and you make that reversal.
Right. And that's exactly, I'm so glad you said that, because that's what I was like saying, where's the hope, right? And the hope is in, like you're saying, do the little things that you can do. Even going back, the little thing, we were talking about the exercise. Like, I think sometimes we can be in these health scenarios, whether it's hair loss, whether it's all the other things that we might be dealing with. And to your point, they can feel so incredibly overwhelming. And I think it gives us the opportunity to realize, like, all we have in front of us is this particular day. So what can we do this day?
Yes.
To help towards the healing process. And I love that you said, like, it doesn't have to be a lot. I think sometimes we can, especially if we are prone to, YouTube University and everything, where it's like, you got to work out for 10 hours a day and you got to do all these extreme things. And it doesn't sound like it has to be like that. It sounds like it's more the smallest things that we can be consistent with over time. And of course, trusting God. I was reading something even this morning, like sometimes we just need to take these small acts of faith, and then God and his wisdom and his gift can supercharge that. We just need to take that one step of faith towards this healing process for some of us, right?
Yes. Because it's almost like when you think about Jesus in the Bible and how in the times he healed, I like to think about the man with the arm where he said, stretch out your arm. It will, there was action on the part of, he could have just, just do it to me. Just do it to me. I don't want to do nothing.
Right.
Do it to me.
Right.
But there's action, at a point. I mean, you just remember in scripture where it says, who drew power from me?
Yes.
And it wasn't, you draw power by moving forward and reaching out and touching. There's action. There's action. And some of those actions, it's not even like a marathon. It's not even like the person who was healed was the one that organized the Sermon on the Mount.
Right.
The one that stretched your arm out. They were the
Right,
ones that
right,
touched the tip of the cloth wasn't even the person that bulldozed to,
right.
it was the person that said, let me just touch that piece of
Touch,
garment.
right, right,
It's the little movements.
right. The small things. And I think we also need to, I say this as someone who's kind of stepped away a little bit from different types of social media. Like we might need to stop consuming, because that's what helps with the overwhelm in
Yeah.
terms of everybody's opinion, everybody, and obviously you're watching this for information as well. But at some point, we might need to slow down and then put into action and taking the right next step with what we know right now. Like we're
Yeah.
not going to be held, I don't think we're going to be held accountable for information that we don't know, or for all the things that, you know, this person is doing this and that person is doing that. No, what does he want us to do? And to your point, when he told the man, I was telling someone this the other day, when he healed, we told him to pick up his mat, right, and
Yes.
walk. And then he also asked someone, do you want to be healed?
Yes.
And we need to maybe have some of those conversations with him, right? Or if he might be asking, do you want to? And there are other times when he said, I absolutely want to heal you. Someone said, if you want to, Lord, you would heal me. Jesus said, I want to. He said,
One
I want to.
one thing I also love, because like I spend a lot of time trying to read into healing in the Bible and how Jesus healed, because Jesus healed. Woo!
Yes.
Jesus
Yes.
healed. And it's like sometimes you think it goes back to stewarding our bodies, right?
Mm-hmm.
What you touched on. Am I living in a way that I can be healed? Or
Mm-hmm.
am I living in a way that juxtaposes? Do I truly believe I can be healed? And am I living like that?
Right.
I think a lot of times we're doing things in a self-destructive manner
Mm-hmm.
because of traumas that we've had and complexes we had, and the way we see ourselves, the distrust we have.
Mm-hmm.
And sometimes it's like we just have to look at now and believe and have the vision,
Mm-hmm.
and that might be enough to change our trajectory. For
Mm-hmm.
example, if okay, let's say I'm struggling with diabetes, high blood pressure, and obesity.
Mm-hmm.
I don't feel well. I am depressed about my situation. I'm in a work situation that doesn't give me the time to move around. I don't have the funds to buy all these fancy supplements or to seek out all this additional help and alternative therapies. But really, the problem is I feel like I'm doomed. I've given up.
Mm.
This help is not for me. Even when you pray and you take it to God, but you have that mentality,
Mm-hmm.
what can really change? How can you see the little things that you can do?
Mm-hmm.
Because all of those things, like not saying that they're not barriers, but I have seen plenty of times people break through those barriers with little things.
Mm-hmm.
With saying, I'm going to eat certain types of food. You'd be surprised the way people can make their diets work for them in a healthy way.
Right.
Saying that you don't have access to certain types of foods. I've seen people do so much with less. It really is the mindset. You
Right.
know, walking in place after every meal is free
Right.
if you
Right.
can. I mean, I know some people may have, arthritis, but they're even you could do arm swings. It's the mindset
Right.
and believing in yourself and believing and having a vision for yourself and
Mm-hmm.
the releasing your past trauma, releasing past beliefs that no longer serve you, and
Mm-hmm.
embracing something that you feel will take you to another level.
Right.
That's where
Right.
it comes from. I mean,
Right.
that's what it's gonna. Like I said, I've seen patients in all walks of life. I've had patients and family members. I sit on their beds and I say, "Tell me." What did you do? How did you do it? You
Mm-hmm.
know, I've had patients are 93 years old, and I say, what did you do to get here? You know, and they'll tell me, you know, I don't eat this, I don't eat that, I don't partake in this, I've never done this and that, and all walks of life. And they
Mm-hmm.
may not have much, but it was what they did with it, and the boundaries they set for themselves in the process.
Mm-hmm. Mm-hmm. Yeah, it's a journey.
It's
Like
a journey.
it's certainly a journey, and I think if anything, as we sort of round out, a couple things we talked about: stewardship of our bodies. I think even the we ended here, but we could have even started with this: is our mindset and our heart, right? And some of us might need to just start with confession, right? I've done that. I'm in the journey of that as my well, like of myself as well. Like what I haven't been a great steward, right? But there's always new mercy, new morning, right?
Yes.
And and now that we have so much information and support and resources, and I think the other part that I love about even this discussion with you is that it doesn't have to be like hard. Like it's not like we have to, uh, it's simple and it needs to happen, but it's not as though we have to, work out for 2 hours every day and, only eat dirt and water. Like these are all things that we
Yeah.
can do. I think this is something that can be done. We can do this. We can
And
do
it can
hard.
be enjoyable. Like I
Right.
look at my dad, and my dad, he's one of those guys that he's set in his ways. And to see him now with so much freedom, and he made such little changes.
Mhm,
My aunt made such little changes, but they were
mhm,
changes that stuck. I don't think my dad has ever gone to the gym.
mhm, mhm,
I don't think he's ever gone to the gym. I don't think he's ever going to, go on a juice fast or go buy an expensive, whatever.
mhm,
But
mhm,
I'll tell you what, he will walk, he will make an
mhm,
effort to
mhm,
walk around the block. He will make an effort to say no to certain foods and
mhm.
choose other foods. And, it's those little tiny, minute changes every day. And when you do it for long enough, it becomes a part of you.
Right, 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 right. So, is there anything else that we haven't talked about or touched on that you want to talk about in relation to reversing um, diabetes and insulin resistance?
Yeah. So, um, if you do have diabetes, well, the first caveat I want to say is a lot of times we're talking about type 2 diabetes, not type 1 diabetes. They're two different pathophysiologies. Um, Type 1 diabetes is more genetic. A lot of those patients are dependent on insulin because their body does not produce it. So, some of the recommendations that we make may not apply. Um, and also, if you do have type 2 diabetes and you're trying to reverse it, it's very important that you are in touch with your physician, and you're regularly measuring your blood sugars. I tell my patients and my clients all the time, a lot of the warnings that come with some of these supplements and some of these activities are for low blood sugars.
Mhm,
And a lot of times, I would rather have your sugars in certain situations running high than low, because
mhm,
low blood sugar is something that you should worry about as well. And we call
mhm,
that hypoglycemia. And while hyperglycemia, high blood sugar, could kill you over time, a very low blood sugar could kill you immediately. So if your blood
mm,
sugars are in the 20s and the 30s, that is a critical. That is a critical. So this is why, mainly if you are on blood pressure medications, if you're taking insulin, you're taking medications that are going to make your blood sugar go down regardless of what you do, that
mhm.
medication, that injectable is going to do what it's going to do. And when you start implicating a lot of these changes, well, what we want to happen is going to happen. So it's important that when you start on this journey, to keep your doctor in the loop. Some doctors can half your doses. Some doctors can give you instructions on how to adjust your insulin. A lot of times I'll tell my patients how to adjust their insulin. If you check your insulin this morning, if you check your blood sugar this morning and it's this level, half your dose, take less, do this, hold this dose. So you can have that conversation with your physician or your provider and tell them, hey, I'm thinking of embarking on some of this. I'm thinking of taking these supplements. Could that have an effect on my blood sugar? And what should I do in this case? So give them the heads up, be in the loop with them, and possibly get a CGM so you can know real time what your blood sugars are.
Okay, that's very helpful. Very helpful. So in the last video, we had quite a few people ask how might they get in touch with you. So we'll put your socials and your website in the description box. But one of the questions was around, are you seeing new patients or taking clients? So feel free to share with us any of the many ways that maybe they can get connected with you to work with you directly.
Yes. So I have a health coaching service where I work with clients day to day, week to week, month to month. And I really love that for diabetes reversal, high blood pressure reversal, even weight loss. But you have to email me, and that is on a limited basis. I only have a limited amount of seats for that. But what I do also have are health consultations where I have an hour-long consultation where we can go over everything, and I can give you my feedback on how you can proceed. And then you can see me month to month. And that's all on my website as well. So a lot of clients do thrive on that, especially when they have, something that they want to address. And if they want to address with their doctor and figure out how to maneuver that, I take my time. We go over all of it. So those are the two options as well. And if you don't want to use that option, I do have my books as well that goes over everything. It has a protocol in it. So I always recommend, I try to put the education in there, that if you don't need that education, go straight to the protocol towards the end. I give you a protocol on the diet, the supplements, even down to how much lowering of the A1C to expect, the different exercises. I also have like a sample meal plan. I had a client tell me I was able to lower my blood pressure just off that 7-day meal plan that you had. So, it's there. The book is split into 2 parts. So if you want to get the book just for the protocol and you don't want to, you don't want to particularly sit down for a health coaching or a health consultation, that's an option as well.
Okay. And we will link everything in the description box. So you have all of the resources that you need to help you take the next right step for you. So Dr. Christine, thank you. Thank you. Thank you. It's interesting. I will say I've had quite a few specialists and people here on the channel. And for each one, for all of you that I've had, it's a personal call to action for me as well, because while my hair has grown back, I certainly have other areas that I need to work on. So having read your other book, and I'm going to certainly get this one and really put into practice the things that you're sharing so that we can, I can nourish my crown from the inside out. But even I think the last thing I'll say is the thing that I think is even more important is that I believe we all have something to give to society. We have purpose. We have things that we are here to co-create with God. And if we are not feeling well, if we are not healthy, if we are not in a position to even engage in that work, then we are in many ways not being able to live the life that he's called us to, the rich and abundant life that he's called us to. And I'm not talking about finances. I'm talking about he wants to work with us to do good work in the world. And one of the first steps is for us being in good health, I think, and as we can, right? We know that all good gifts come from the Lord. So
yes.
Anyway, I'm rambling a little bit, but anyway, thank you so much.
Thank you for having me.
Don't be a stranger. Don't be a stranger. So as always, everyone, live well, live blessed, nourish your crown, and we'll see you in the next video.